Facts, not fear.
Hello, everyone, and thank you for joining us as we continue to track the spread and impact of COVID-19 in our community. I'm Deborah Morgan.
And I'm David Crabtree. Tonight, we're going to hear from local health experts about what's going on now and what we can expect as we attempt to move forward. First, let's check in with Gerald Owens in the newsroom for the latest headlines. Gerald?
David, the big headline out today, this battle to slow this virus is just beginning, and we all need to do our part. Today, new suggested guidelines and a new tone from the White House. The president's coronavirus task force outlined new guidelines today for our country. It includes recommending against gatherings of more than 10 people, avoiding bars and restaurants, and stopping or limiting unnecessary travel. Now, it should be noted that several states and cities have already shuttered eating and drinking establishments. A couple of other headlines. There are 36 confirmed cases in North Carolina. 15 of them are in Wake County. The Dow plunged again today, down nearly 3,000 points. It was struggling before the president mentioned the virus may send the country into a recession. And all Triangle YMCA facilities are closing in about an hour until at least March 25th. Now, before I send it back to you, I want to mention the president also said we could be dealing with coronavirus until July or August at the earliest. The bottom line is we have a long way to go. Back to you.
Gerald Owens, thank you. Joining us now, Dr. Elizabeth Tilson, the North Carolina State Health Director, no stranger to any of us now. Thanks for coming back in. Steve Lawler is the president of the North Carolina Healthcare Association, and Katie Galbraith, president of Duke Regional Health. Everybody's busy. Thanks for giving up your time tonight. Sure.
Dr. Tilson, let's start with you. We're calling this facts, not fear. So put into perspective now how many cases we have, how many tests you've done, and I believe you said today one person in the hospital out of the positive cases, correct?
Right, so what we're seeing across the state is a slow uptick in the number of cases, which I think we were expecting. To date, all of the people that we have the information on, everybody's had either history of travel out of state or a known contact with a person. So we still don't have what we call documentation of community spread. Now we are, which is good news. Mm-hmm. We do though expect that there probably is some low level community spread out there. And so that's why you've seen then a lot of the ramped up recommendations and mandates that you've seen over the week in order to help do that social distancing. In order to really slow the uptick of the cases across the state. But right, to date, the majority of people, vast majority of people who had been positive have been doing fine and been able to stay at home. So that's a good thing.
We don't know yet if any of those early cases have rotated into the column of recovered, do we?
I don't know at the individual level, but what we have now is some good evidence that really, if you are 8 days after the onset of symptoms and then 72 hours after having any symptoms, then you're considered recovered. So my guess is some of those people have now probably rolled off into that recovered phase.
Dr. Tilson, earlier today in your news conference, and I'm paraphrasing you, but you said basically we're better off today than we were yesterday, and we're hoping to be even better tomorrow.
Right.
And yet this afternoon from UNC, we're seeing predictions that as early April, we could see more than 1,000 cases in North Carolina. That's a major jump being predicted in 2 weeks. Where do we fall in that?
Yeah, and so it's difficult with some of those predictions because you can do the predictions without all the social distancing pieces that we put into place. So making a prediction with the level of social distancing makes that a little bit of a hard calculation. But what we're trying, and the point of social distancing is not to prevent people from getting infection. It is to really decrease that peak so that we're sure we can respond to people as they are getting that infection. So we want to see a dampening of that peak. And so how the analytics work with how many people at what pace with the amount of our social distancing, that's a hard thing to predict. But we're trying to be really proactive so we can dampen that peak so we can be in the best shape as possible to respond.
Well, and I think it's so difficult too because some people hear some of those alarming numbers and they are more panicked, they're more worried. So how do we calm people? Because I feel as though sometimes there's so much information coming in. Katie just talked about this being the first epidemic really in the social media area. So Dr. Tilson, how do we calm people?
Yeah, and I think you're right. I think this is the first crisis we've had in the evidence or in the arena of social media, right? So I think always make sure you're getting information from trusted resources. Go to our website, go to the CDC website, making sure, watch programs like this that you have fact, not fear, and do the things that you can do, right? When you're in a case of fear and anxiety, and that fear of not knowing what to do adds to that. So do the actions that you can take. And the actions we've talked about, the everyday practical actions, right? So wash your hands, don't touch your face, wipe down all the surfaces, stay away from our sick, and then practice the social distancing recommendations. So I think if people can take control of their actions, that helps to allay their fears.
I'd like to get a response from the two of you about what we have heard, some predictions of worst case scenarios, and running out of ICU beds, not having enough respirators across the country. That would include North Carolina. As you look at Duke Hospital, the system, you look at the healthcare industry, what type of preparations are you making with the president telling governors today, you need to find your own respirators. We'll help you pay for it, but we can't do the work for you?
Yeah, I think that's an excellent question. And, first of all, I do believe we are well prepared and we're well positioned in this state. Certainly at Duke Health, we have increased our critical care capacity over the years, and we built a critical care bed tower on our university hospital campus. We've enhanced with 24/7 intensivist coverage in our critical care units at our 2 community hospitals. And so, but the reality is right now we have, we bump up against that capacity. So what we're doing is being really proactive and looking at, on a daily basis now, what are the cases that potentially could be postponed. So, and we've heard a lot about elective cases, postponing elective cases. I think it's important to remember that an elective case doesn't mean that it's an optional case, right? So when someone is coming in for care, we need to carefully balance the need and the burden of their own disease and whether delaying that operation, for example, that surgery would increase their risk over time. And so we have physicians who are meeting along with our administrators on a daily basis to look at that and look at how we decrease capacity so that we will be able to manage what we may see in terms of surge over time.
Steve, is this a concern here in North Carolina? Obviously, cities that have a more dense population and the hospitals trying to serve a more dense population in New York City, for example,
Right.
would be worried about this. Do we have to worry here in North Carolina?
Yeah, so what Katie described is something that's going on throughout all 130 hospitals throughout our state. So, ever since, this started to appear in the United States, hospitals in North Carolina started planning. So as Katie said, we've, kind of taken the plans that were done during H1N1 or plans that we're required to have every year to respond to a disaster. We've tightened those up because this is unprecedented. It's different than anything we've dealt with before, even though we've dealt with floods and hurricanes and people have been heroic. Well, we're prepared to be heroic again. So I think what we're seeing are hospitals and health systems throughout the state kind of looking at, their daily capacity, looking at what's planned for the future, and then making sure that they've got additional supplies, additional staff, plans to help patients and families actually access care outside the hospital. One of the things that's really kind of a blessing in North Carolina, if you have one of these, about 80% of the state's population can get care through a virtual visit. So every hospital health system in the state has a virtual platform where somebody can download the app from the health system that they receive care, and they can do a virtual visit to help prevent them from going to the emergency department or going to their primary care physician if they don't need. And that's a great asset and tool for, kind of social distancing and kind of hunkering down in place.
I appreciate what you say about being heroic and in national disasters we have been. But that's when there's an end in sight.
Oh, yeah.
That's when the storm has gone through and then we're picking up the mess afterwards. There's no end in sight right now. How do you be heroic when you don't always know what you're dealing with?
So we have a fair number of, kind of great staff throughout the state that are prior service. And when you talk to them, these are folks that have been deployed deployed to, Iraq or Afghanistan, they describe the situation very much the same way that they describe the tempo and the pace there. So it's really about taking care of each other, looking out for each other. It's having a good work rest plan, and then it's really about leadership, being visible and making sure that people have what they need to do that good work. I think the other piece, and this is really unique to this situation, we have an opportunity as North Carolinians to care for each other. So, take care of your neighbor, take care of that healthcare worker, that first responder that's going to work every day to ensure that you and your loved ones are safe. So, one of the beautiful things about North Carolina is people care about each other.
You're so right.
And this is a chance to really kind of, demonstrate that every day.
Absolutely. Thank you all very much for this portion of our program. We have much more on this very important topic when we come back.
Welcome back. We're talking about the coronavirus, facts versus fear. With us tonight, Dr. Elizabeth Tilson, the North Carolina State Health Director, Steve Lawler, the President of North Carolina's Healthcare Association, and Katie Galbraith, President of Duke Regional Health. Deb?
Dr. Tilson, let's go back to you and talk about testing, because I know you've received a lot of questions about testing today. We've had more testing come online. Walk me through the process. I don't feel well. I have a cough. I may be running a fever. I've tested negative for the flu. What is the likelihood I can get tested? And where do I go to get that test?
Yeah, so obviously testing has been a big point of conversation over the past couple weeks. I think we're in a lot better place now than we have been. We've done a huge amount of work really trying to be sure that we have that capacity, not only at the state lab, and we have now a lot more ability to test more people, but also we've been, a lot of commercial labs have come online and health system labs have come online as well. So that's been really, really helpful. There's a lot of different places that those tests can be run. And so therefore, where you can get tested, it'll depend. Some people then are going through their health system.
So I call my doctor and I say I don't feel well, and they send me someplace? Is that how it works?
I think it'll depend a lot on your practice, and some practices are equipped and have the supplies to be able to do the sample collection there. And in fact, we just sent out provider guidance just this afternoon on a step-by-step, if you want to do it in your practice, how to walk you through that. Some practices don't have those sampling supplies, and so there's other opportunities are through our local health departments, through our health systems. And the other thing that we're doing this week is also think if through our public-private partnerships to set up alternative sample collection sites in order to make it getting that sample collection more accessible.
Are these in the parking lots and the drive-through areas that we've been hearing talked about?
I think it'll depend. As we look across the state, they're going to be set up in different places. But we're trying very hard to make that if you're meeting the criteria. Remember, the criteria is that you have a fever, you have a symptom of lower respiratory symptoms, so cough and shortness of breath, and then flu negative. I'll just say that we have a lot of flu in North Carolina now, a lot of flu in North Carolina. And of the tests that we've run, a low percentage actually are coming back positive for COVID. So if you have a flu-like illness, you are far more likely to have the flu or another virus than COVID-19. So I just want to make sure that we're aware of that. But we know that people getting access to the sampling has been a barrier. So we've been working really hard and got that guidance out, thinking about other sites. Our health systems are coming on board. And then the laboratory testing behind to run the test, a lot more capacity there. So.
And the odds are the more people are tested, the more cases for positive we are ultimately going to see.
Yeah.
Is there an equation somewhere within all of this that lets us know we're out of the woods? Is there a target number of tests of people to know that we have surpassed where we have to be? Who wants to take that on? Dr. Tilson?
Yeah, I'll take that, and I think the answer is no. I think that when we think through, so testing helps you in the beginning of an outbreak. It helps you when as we talk through how you respond to an outbreak. The first stage is what we call containment. So that's that rapid identification of somebody and then their contact tracing, if you want to really try to minimize the spread. As we move through and have more community spread, then you also want testing in that beginning so you have an idea of how much of community spread that you have. But once you have documentation of community spread, then the actual importance of the testing goes down.
Is it easier to control, though, if we have a clear picture of how many people actually test positive?
It really is a clearer picture of how widespread the disease is, because then once if and when we have widespread community disease, then we know that answer. Then we can change from having people tested to, ooh, you have symptoms, so if you are sick, stay home. If you are clinically well enough, stay home, and it's only you want to seek medical care if you need that supportive medical care. So how you shift and how we'll respond depends on how widespread the disease is. So there's not a magical number. It really is, do we have documentation of widespread disease? Then testing isn't as helpful, and then we can switch to then, if you're sick, stay home, and then you seek medical care if you need it.
Right.
I think we're all doing a great job of washing our hands, of using the sanitary wipes. I mean, we are certainly around the newsroom here. It is, we're social distancing, a lot of changes are to be had. Does it give you, and we talked about this right at the beginning, it's good news that all of the cases that we have so far are from travel or from contact with other people who have traveled. So that has to be a good sign that we all are doing a good job of not having it be a community spread. Is that accurate?
Yeah, but we do expect there to be community spread. And again, remember that the vast majority of people, if they get this infection, it's going to be a mild to moderate illness. And so what we want to do is have it be, again, a slow burn, and that most people have a mild illness, and that hopefully we can limit the number of people that have severe illness, and then we can minimize the surge that our healthcare systems are going to have to respond to. So it's that really kind of blunting of that peak, and then that slow burn, so that we can respond to it, and protecting the most vulnerable around us. And if you remember last week, we were really focusing on, we know people are at higher risk of clinical severity, are older people over 65 with underlying medical care. If we can protect those people and have a slow burn with people that have that lower risk, that helps our healthcare system to be able to respond to the people that need it.
And I think that's a great point. So I think when we think about the work that the Secretary, with Dr. Cohen and Dr. Tilson are doing with their teams, to kind of help mitigate, rapid contamination of this virus, it allows hospitals and health systems to really focus and kind of harden their facilities so that we're focused on those that are most vulnerable. I mean, the fact is, the majority of people who get this can take care of themselves at home. So we really want to kind of reserve those precious assets for those folks that are most vulnerable and are elderly or medically compromised. That's who we're focusing on right now.
And Steve, with that in mind, we're going to take a break. When we come back, I'd like to talk about what hospitals are doing today, not only to get ready, but what you're dealing with patients coming in today and their families. Right. We'll be right back. We're back. I'd like to talk to Katie Galbraith about, in particular, what's happening with local hospitals and the new rules that are in place. It's a new normal for hospitals now. Not everyone can come in. I understand in some cases chaplains aren't allowed to see patients.
So we have really heightened our visitor restrictions. So we already had visitor restrictions in place because of flu and the widespread flu in our state. We heightened those actually starting today at the hospitals throughout the Triangle. And so we are limiting at Duke to one visitor per patient. And we have a screening process very similar to what I saw when I came into the studio today. You have a wonderful person up front who asked me questions to see if I had any symptoms. So we're asking those questions, 3 very simple questions of our visitors when they come in, and then patients are required to have only 1 visitor per patient.
Do people
that could
have
be clergy.
Do people have their temperature taken? What does your emergency room look like as people just walk in the door?
So currently we are not taking temperatures for visitors. And our emergency department, actually is managing this very well. They are used to surges in capacity, surges in volume and the number of people coming in and those fluctuations. So right now I think you would come and you would see that it is very similar to any other day in the emergency department. We call it sort of controlled chaos in the emergency department. But our team is doing really well at managing that. And I would say that our patients also have been very understanding today as we've implemented this,
Steve,
and the visitors.
I'm sorry, you've been in this business how long?
40 years.
What keeps you up at night now?
So I think the things that keep me up at night, especially when we're thinking about this, one is staff resiliency. I mean, how are we making sure that we're taking care of those people that are taking care of others, making sure that they're cared for, they don't have to worry about their children that are not in school, but we're going the extra mile to make sure that that's done. I think the second piece is how are we working together with public health and with the state to ensure we have consistent messaging, because I think consistent messaging really helps build confidence amongst the public.
Absolutely.
That
That's what we're trying to
this is
provide
how we're
with
going to
this.
work together to make sure that the 10 million people in North Carolina are taken care of. And then finally, it's speed to execution. How quickly can we take great ideas and then convert them into practical solutions, such as, the drive-through clinics, or, soon patients will see hospitals that have an outer shell where patients may get triaged before they get to the emergency department, so we can separate those patients that may be positive that need to be tested with those patients that need to come in the emergency department for emergent care.
I think you've all referenced this, and I want us to do this again. While this can be a deadly disease for a very small number of people, and if it happens to be in you and your family, that's terrible. But for the vast, vast majority, people will recover from this virus. Yes. And fewer people will be hospitalized than we see at times for something like flu or other illnesses. How do we continue to push that message for that to resonate with people? What can we do a better job of doing?
Well, I think programs like this, what you are doing here, really focusing on facts, not fear. That's exactly what we need. We need to get out the factual information and be a source of truth for the community.
Dr. Tilson, what would you like to see us do that we're not doing?
Yeah, and I think that as we have more people that get the infection and then recover, it's going to be more and more of a norm. I think thinking through, is there a way that, obviously with keeping people's privacy, but a way to focus in on, there's a lot of people who will recover from this. The vast, vast majority of people are going to recover from this. And so I think us, again, stressing that but I think we need to balance that. We do know there is a subset of our population that is at higher risk. So I think we need to be very mindful of protecting the people at higher risk. And again, those are older people with underlying medical conditions. So thinking through, making sure our nursing homes, our long-term care facilities are well protected, but then recognizing the younger and healthy people, if they get it, if mild, very moderate symptoms, it might feel like the flu or even less. So I think making sure people remember that, but also make sure there are a subset of population that we need to be very mindful of protecting.
Do you think that we're overreacting at all? As we try to balance with this, we try to balance the fact that a lot of people will recover. Yes, it can be deadly, but a lot of people will recover. And now the president is coming out today saying it could be July, August before we get through this. Limit your groups to 10 people. What do you think?
I think that's a really good question. I think that's the question that many of us are asking and grappling with. But what we're trying to do here is really sort of flatten the curve. As Dr. Tilson said, not have everyone get sick at once, where we overwhelm the healthcare system with those who are most acutely ill. The vast majority, again, are not going to get acutely ill, but we need to protect those who are at highest risk. And so that's really what we're trying to do here. And that's the point of the social distancing. That's the point of all of the restrictions we've put in place.
I think we're a people that really value our independence. But we're also a country that has a tendency to come together during tough or difficult times. Well, this is a tough and difficult time. And we're going to face this and we're going to get over it. I do think Dr. Tilson said something really important. So hospitals are working closely with long-term care facilities and nursing facilities. Those are populations we saw in Washington were at great risk. And we're making sure that we're helping them and their patients kind of succeed in this situation. But I think the key is not to visit.
Sorry to interrupt you, but we have to close there. Stephen Lawler, thank you. Katie Galbraith, thank you for coming in. Dr. Tilson, thank you for coming back so much. We so value the input that you're giving us and the community.
And thank you so much for joining us as we get through this together. Have a good day.